Hello everyone, my name is Ruth Goff and today I will be presenting my poster presentation for NSC892 titled Exercise, a New Solution for Depression. So before jumping right in, I just want to say first of all, thank you for listening. Thank you for being here, and I wanted to just say that the reason I chose this topic is because I just know so many people personally in my family and friends who suffer from depression, people I know that have, attempted suicide, just gone through some really hard things. And so I think it's super important to talk about this topic. I picked exercise as something to talk about too because I work in an inpatient psych unit and I just know so many patients that are non-compliant with medications and therapy and the things that we already know work really well. And so I think looking at alternatives is always a good idea. So the question that really sparked my research is, in patients diagnosed with depression, how does exercise compared to lack of exercise affect depression symptoms within 3 months? So looking at some statistics from the CDC, depression is a national epidemic impacting millions of Americans. 1 out of every 6 adults will have depression at some point in their life, which is a really big statistic if you think about it. That means that if you haven't already encountered someone who has depression, you likely will at some point in your life. And there has been a 2.6% increase in the suicide rates in the United States since 2021 compared to now, which is pretty significant as well. So that's kind of why I'm talking about this topic. I think it's really important, and obviously it's a big issue in America today. So when looking at my supporting evidence, the first study that I looked at was a level 1 evidence, which was titled Exercise Interventions as the Primary Treatment for Depression, Evidence from a Narrative Review. The main conclusion that the narrative review reached is that supervised aerobic exercise and progressive resistance training are effective for treating depression even if no antidepressants are used. I think this is something that was really significant because not only is it level 1, so it's really scientific, very thorough, looked at a lot of different randomized controlled trials, but it was also cool because it talked about how it was effective even if no antidepressants were used. And so that was really hard to find because a lot of studies talked about exercise plus antidepressants, exercise plus therapy. And so it was really interesting to see a study that was, level 1 that talked about it being effective just as exercise. My level 2 evidence was titled Resistance Training for Black Men with Depressive Symptoms, a pilot randomized controlled trial to assess accessibility, feasibility, and preliminary efficacy. And the conclusion drawn from that study is really that resistance training lowered the PHQ-9 scores compared to the control group, which was simply education on health and wellness. So I liked this study because it looked at basically the PHQ-9 scores being like the main kind of outcome evaluation. And I thought that was really good to have something measurable to look at the end of everything. And then my final study that I looked at, it is a level 5, so it's not as scientific as, some other ones are. But even though it is a qualitative study, I think it's really important to talk about that in regards to depression because, like I said before, I do work in an inpatient psych unit, and that is something that I meet a lot of patients that have issues with like non-compliance, and they don't want to do therapy, they don't want to do meds, they don't want to do anything. And so my understanding and belief is that if people are not behind it, they're not behind the treatment, then they're not going to do it, and then it's not going to do anything. So it was cool to see this, qualitative study because it included quotes from participants who basically said, yeah, I support this idea and I'm accepting of the treatment of depression. The treatment of exercise to treat depression. And essentially, I just thought that was really cool. They also did talk about some of the barriers, which I think is important to understand as the nurse practitioner, just some of the barriers as to why people, won't always be accepting or participating in exercise. So it talked about some of the symptoms, such as like fatigue that comes with depression, also just like socioeconomic issues such as like, attending a workout session, maybe not having the transportation to get there, just different socioeconomic issues. Moving on to the theoretical framework, Pepla's writing titled The Quality of Life, an Interpersonal Perspective, she speaks about basically the importance of interpersonal relationships and how that can really impact someone's health. And so just looking again at the nurse-patient relationship, my belief is that without a stable nurse-patient relationship, it's really unlikely that the patient will be able to get better on their own, and that they really need that relationship to take the next steps. When looking at the implementation plan, it's pretty simple, pretty straightforward. I would, recruit patients through implementing the PHQ-9 screening questionnaire for those waiting in the clinic. The questionnaires would be available to all those waiting in the area. So people would have the opportunity to fill it out if they choose to. Those that score positive on the PHQ-9 would be invited to join the study. The team would then meet to discuss how the plan would be implemented and discuss roles of the individuals leading the study. Study participants would be explained the requirements and expectations of the study while making it known that it's still totally voluntary and they can leave at any point. The participants would meet once a week for a 30-minute exercise group. They'd be expected to complete 30 minutes of additional exercise outside of that designated time. The team would meet once a week to talk through the duration of the study, discuss the progress of the study, and evaluate how the participants are doing. At the end of the 3-month period, the participants would take another PHQ-9, and then the team would then analyze the results. So the outcomes are very simple. It would be basically at the beginning, you would take a PHQ-9. At the end of the 3 months, you take another PHQ-9, and then we compare them. So outcomes will be measured at the end of the 3-month mark using the PHQ-9 questionnaire. At the beginning, they would take the PHQ-9, and then at the end, the results will be compared. The initial results will be analyzed and compared to the results after 3 months to see if there was a significant reduction in the levels of depression. And finally, when discussing the timeline, I wanted to keep it pretty simple, mostly because I think that with this topic, I think that there's so many people that would, qualify to be in the study, and that it is pretty straightforward overall. So I would give it, 1 to 2 weeks of the initial process for gathering participants. And like I said, I think that's because a lot of people, have depression, and I think a lot of people would score positively on the PHQ-9 assessment initially. And then you'd have, of course, the weekly meetings for the interprofessional team, and then 3 months of implementation of the project. So the project itself would take 3 months. And then the follow-up with outcomes an additional 1 to 2 weeks. So, I don't think it would be too complicated or take too long to compare, the original PHQ-9 to the 3-month follow-up. So yeah, that is basically my presentation. I hope you enjoyed it. I hope you learned something. I'm just really excited about this topic. It's honestly been really fun to research it, because I do think, whether we work outpatient or inpatient, I know a lot of us are planning to work outpatient, this is great for implementing. I think it also would be really great to see more, psych units like try to do more active things with their patients there, and just really see kind of what the impact is. So it's really been exciting, and I hope you appreciated it and enjoyed listening to this. Thank you. Bye.